Welcome back to Your Health radio and television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon. I'm so delighted you could be with us this afternoon. And we have the illustrious Dr. Doug Sunde, board-certified plastic surgeon, as my next guest. Dr. Sunde, thanks so much for being here today.
Dr. Morwood, it's my pleasure. Thank you for having me.
Dr. Sunde, we're going to talk about a very hot topic in plastic surgery, and that's fat grafting. But let me back up for a moment. We've been doing tissue grafts for many years, right? I think most of our audience has heard about skin grafts. We do bone grafts, we do cartilage grafts, we can even do vessel grafts. We can even do vessel grafts. Now, what's this business about fat grafting, and why is there such a buzz about fat grafting?
Well, Dr. Morwood, I think you're just right. I think almost everybody in the audience has heard about a skin graft. For instance, if you've been burned, you take a piece of skin off your thigh or your buttocks and put it onto a burned hand, and it heals. And it's just a miracle of the body that the tissue can develop a new blood supply from the intact body and come alive again. And so those same concepts, which were so miraculous when they first thought of them years ago and now seem commonplace, have been applied to fat. And so what we do is we take fat from one part of the body and we move it to another part of the body that lacks volume.
Okay. Now, Dr. Sunde, I have an important question for you before we go on. We talk about grafts because we move one part of the body to another part of the body, bone graft, skin graft, as you described, etc. Now, there's a lot of people on waiting lists for heart transplants, liver transplants, and they will actually get a body part from someone else. So, for example, let's say I needed a skin graft. Could I just borrow it from another person who had extra skin and put it there? Can we do that?
We can, but it's much more complicated. So when the first kidney transplants were done, they were done between identical twins because your body doesn't know if your identical twin, your DNA is the same and one's the same as the other. And so your body didn't reject it. When you use other people's tissue, for instance, things we, again, hear commonly, a heart transplant, liver transplant, typically a kidney transplant, then your body has to take special medicine so your immune system doesn't reject someone else's organs. So, for instance, if I took someone else's skin and put it on you, your body wouldn't incorporate it, it would reject it because it knew it was foreign. With the tissue we use typically, we try and use people's own tissues or spare parts to move it from one part to another.
Okay, so it sounds like the body has a mechanism, our immune system has the ability to recognize what tissue belongs to itself and what tissue is foreign. Is that right?
Exactly, and the white blood cells are circulating in your body and they're like the police. And they go around and they're on their beat and they look around and look for foreign things. If they're foreign things, then they go after it and reject it because you wouldn't want other people's tissue. The thing is, if, for instance, a skin graft, when you take it from the leg and put it on the hand, the immune system comes around and looks at it and says, oh, that's the same tissue, it's just in a different place, so that's okay.
Well, Dr. Sunde, I know you have excellent training, and you ran a burn unit for a while, actually, and of course, during training, I ran a burn unit as well. But sometimes we actually use what's called a xenograft, right, porcine xenograft, or cadaveric graft for someone severely burned, and we can actually apply it to a burn. Now, is that a permanent thing or a temporary thing?
It's a temporary thing because a lot of people's immune systems are very compromised at the time of a severe burn. So that can be a temporary way to close it, kind of like a very fancy dressing. In Japan, when children are burned, initially their parents give skin grafts to cover their children's wounds. I think it's a motivational thing to make sure your children don't get burned as well. So that's a temporary thing and not a permanent thing.
Okay, so Dr. Sunde, you know, I really admire you and I have lots of questions for you, and I think this is very helpful to teach our audience about these things. So one more question before we get on to our real topic, which is fat grafting. When we do breast reconstruction, you talked about moving spare parts around or body parts. Sometimes we'll take abdominal tissue or tissue from the back from the latissimus and transpose that tissue to the breast area to rebuild a breast mount. Now, do you call that a graft or do you call that a flap?
We call that a flap, and usually that's a large amount of tissue that has its own blood supply. So you bring the blood supply, which brings in the oxygen and takes away the degradation products, and then it doesn't need to get a blood supply from the new tissue. A graft isn't, you take it off and then it's no longer alive, and you put it on the tissue and it has to develop a new blood supply.
Okay. And I appreciate that very much. So let's go back to our important topic that's hot right now, fat grafting. So there are times when we can actually take fat from someone. It's got to be the same person. We take fat from one part of the body and we transpose it to another part of the body, right? Like I'm lucky enough to work with you, and we've done this to give people higher cheekbones, right? You've done this to, say, fill in traumatic defects or defects after an injury. We're starting to do this for breast reconstruction, right? We may in the near future do this for cosmetic breast augmentation. We've done this to enlarge calves, etc. So let's talk about some of the mechanics of how we harvest fat from one part of the body and transplant it or transpose it to another part.
So fat grafting is a new, relatively new field. You and I have been doing it for a long time, about 14 years now. But we've begun to refine our techniques with some of the other people. There's a leader, Dr. Sid Coleman in New York, who really has been a pioneer in this field. And the idea is it's a way to give the body volume. And the body needs volume for a lot of areas. For instance, if people's cheekbones go down, we need to be able to fill those. Sometimes the folds in their face get deeper, and we need a way to fill those. Some people, if they've gotten a dog bite and they lose volume, we have to be able to try and rebuild that. And so by adding volume and fat, that can be really helpful. How we do it is we take and we harvest it very gently so we don't kill it, and then we centrifuge it to get the fat cells in a larger group. So we just get the good fat cells, not the fat cells that have been injured, and then we gently inject it into the areas.
Okay, so Dr. Sunde, I want to go over, again in specifics, some of your favorite areas or where you think fat grafting works well, say for example in the face. So I know you do excellent facelifting work, and I know you'll oftentimes use fat grafting in conjunction with, say, a facelift. Now, why is it that you don't do just the facelift? Why do you need to do fat grafting as well?
I think one of the big concepts that's happened in facial rejuvenation over the past few years is a lot of these people, they would lose a lot of fat as they age, and it would move south and it would atrophy. And so when you would tighten their skin, they would look tighter, but they'd look very flat. And so what the fat does is it is able to give you that third dimension back of volume. And I think there's a big thing of volume is youth. A lot of people who are very heavy look younger than their age, a lot of times because they have all this extra volume. So we don't do it to make people look crazy or operated on. We just want to restore their normal youth.
Okay, so what are some of the areas on the face that you like to do fat grafting for?
I think the best areas are the cheekbones. Just a little bit in the cheekbones, very helpful. The folds between your nose and your lips down here.
And we call those the nasolabial folds.
Nasolabial folds. The corners of the mouth. Some people have a real deep crease above their chin, which can be very helpful. And some people have a little trough right along the edge of their eyelid and their cheek called the tear trough, because that's where the tears would kind of run down. All those areas I think are excellent for fat grafting.
Dr. Sunde, I recall a professor in training trying to use the analogy that if you have a grape that's full and rich and it's in the sun for a long time, it's going to shrink and become a raisin. And so if you use the analogy of a facelift, instead of just restretching the skin on the raisin, we plump it up and fill it up. Is that right?
Right, and people really need both. So I think that it's interesting because some people for a long time were saying, we're going to just do fat grafting only. And that's a little bit helpful. Some people were doing skin tightening only. Again, those are helpful, but the two tools together are very powerful.
Okay, so let's go over before we go on to different areas, let's go over some of the mechanics of how we harvest the fat, right? Now, is it the same as liposuction? Is it the same as when you harvest tissue from the abdomen, say, to do breast reconstruction, or are those different?
I always tell the patients we're going to scour your body and try and find a little fat. And for most people, we're able to find a little bit of fat on people, typically around their belly button. For liposuction, we take out large amount of fats with higher pressure. because we don't really care if the fat cells live. We want to get rid of the fat cells, and so we remove them under higher pressure. With fat grafting, we remove them under very low pressure and very delicately, so that we get the cells to live, so that when we re-implant them in other areas, that they can get a new blood supply and come back to life.
Okay, so you've talked about fat grafting to the face and some of your favorite areas to do for the face. Let's talk briefly about other parts of the body. What about the calves, say? And I recall you recently did a great case where a woman had kind of a traumatic defect of her thigh. It was either from a dog bite or from removal of a tumor, and you helped to actually recontour her thigh with fat grafting. Isn't that right?
Right. Some people who have tumors taken out end up with an indentation, and so not only do they have a scar in the skin, but they have an indentation in the tissue below it. So what we're able to do is put some fat underneath to, again, add volume, so that when they have tight pants on, or they don't look like they have this indentation. It'd be the same thing for dog bites. I took care of one lady from Russia who'd gotten a big injection of antibiotics, and it had killed the fat in her buttocks. So again, it looked like she had a big dent in her buttocks. And really, before fat grafting, all we could do is try and have some implant made to try and stick in there. But now with fat grafting, you can fill that with your own tissue. And if the fat graft lives, it lives forever.
Okay, so I think it's important to our audience. A lot of people in my office, a lot of my patients ask me, what kind of volumes are we talking about? I mean, do you need to take a gallon of fat? Do you need to take just like what we call a few cc's, milliliters?
I think it depends on the areas. For areas on the face, for the cheeks, we would use in ounces about 30 milliliters. So we would use for maybe a quarter ounce for the cheeks, maybe a quarter ounce for the folds in here. So it's small volumes, but when you put them in, they actually have pretty dramatic effects. For larger areas like the breasts or indentations, then we might use much higher volumes.
Okay, now that's perfect segue to my next question. It's a very hot topic now to talk about fat grafting to the breast. And Dr. Sunde, I'm very lucky to be able to work with you, and you and I have done lots of breast reconstruction, and you helped me with my DVD. I'm very grateful for that DVD to instruct women on their options for breast reconstruction. So we have done quite a few cases of fat grafting for breast reconstruction, and sort of on the horizon, I guess we're exploring cosmetic breast augmentation with fat grafting. And we've also done some cases where women have had breast implants removed, or we've also, in addition to putting in breast implants, also did fat grafting, either for reconstruction or for cosmetic. So let's talk about that. Let's talk about breast reconstruction first. What's the current state of the art for using fat grafting to do breast reconstruction, say after mastectomy?
I think there's some really interesting things. They've seen, sometimes with radiation therapy, people can end up with the damage to their skin and some tightness. And so what can happen is by putting the fat grafts in, they've shown some changes where not only does it add volume, but it sometimes can soften the skin as well. And people, at least the suggestion is that possibly there's a lot of stem cells within the fat, and those cells can, in some magical way that we don't understand yet, can help soften the skin and make that better. For the other thing is that, of course, that we can add larger volumes, not too much at once, but larger volumes to kind of make it bigger.
Okay, now but before we go on to cosmetic breast augmentation, we've talked about some fat grafting, and the stem cells brings up the topic of hand rejuvenation. I've seen you do some awesome cases of actually helping people's hands look younger. So do you do fat grafting to the back of the hands to make them look better?
Well, the hands, it's always so funny because when we're done with the facelift and the eyes, it's interesting. Everybody says, well, aren't you going to finish a job? Because their hands still look old. And what happens really with anybody as they age, you can look at their face, but then you look at their hands, and that's the giveaway sometimes. Because they lose volume, and a lot of people, their skin gets so paper thin that it looks like you can almost, look at their tendons and see their blood vessels right through it. And so by putting fat in there, it rejuvenates their hand. We had one lady who told me that her hands also felt warmer after she'd had fat grafts, and I guess it makes sense because it's more insulation.
So fat grafting you can actually do to the hand, and it looks like they have more cushion and they have a more youthful appearance.
At first I was very concerned about that because I thought because that skin is so paper thin that maybe you would be able to see every little drop, but it seems to work out just really nicely. And again, we don't have a lot of science to back us up, just impressions. But in that sense, the impression is it may actually help the skin as well.
Okay, now we only have a few moments, Dr. Sunde, unfortunately, but what about fat grafting for breast augmentation? Can we do that now? Is that right on the horizon, or do we have to wait for a week or two to find out?
I think it's right on the horizon. We're just knocking on that door any day now.
Dr. Doug Sunde, board-certified plastic surgeon, expert in fat grafting. If somebody has more questions, can they call the office? Is that okay?
I'd be happy to. My number's 831-372-0200, or you can call the American Society of Plastic Surgery for a board-certified plastic surgeon.
Dr. Doug Sunde, Monterey, California, expert plastic surgeon, fat grafting. Thanks so much for being here.
Thank you for having me.
This has been Your Health radio and television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon. I'm so happy you could join us today. I hope you tune in again soon. Thanks very much for being here.